Module 19, Nursing Care of Patients with Personality and Eating Disorders. Here you see your learning outcomes. Go ahead and take a second to read over those. Okay, we have our personality disorders. Personality is composed of enduring patterns or traits that determine how an individual perceives, relates to, and thinks about the environment and themselves. One personality develops as the person adjusts to their physical, emotional, social, and spiritual environments. You have your personality patterns or traits. They're inflexible, enduring, pervasive, maladaptive, compulsive, have an inability to emotionally connect. They cause significant functional impairment or subjective stress. Make sure you look at your ATI again on your mental health chapters, and page 1371 talks about personality disorders and how they're characterized by behavioral manifestations. That's a dysfunctional pattern of day-to-day behavior and impulse control. Affective manifestations, those are inappropriate range, intensity, mood, lability, and emotional response. Your cognitive manifestations, there's inaccurate interpretation of self or others or events. And your sociocultural manifestations, these are ineffective interpersonal functioning. They exhibit manipulation, which is a control behavior that's used and exploits others for personal gain. They can be narcissistic and self-centered, and this is where they feel entitled or feel that they're justified in not obeying others' rules. And their impulsive behavior creates difficulties because they act without considering the consequences. The causes are unknown. It could be genetic factors, family environmental factors, neurobiological or neurotransmitter factors, or social factors. There are 10 personality disorders, 3 diagnostic clusters. You have cluster A, which is your odd and eccentric. That is your paranoid, your schizoid, and your schizotypical. Cluster B, you have your dramatic and your erratic. These are your antisocial, borderline, histrionic, and your narcissistic. And then your cluster C are your anxious and your fearful, and these are your avoidance, your dependence, and your obsessive compulsives. In your borderline personality disorders, there's a pattern of instability in interpersonal relationships, self-image, and affects. They're marked impulsive. They have an intense fear of abandonment, intense anger and irritability. They have chronic feelings of emptiness, transit paranoia or dissociative symptoms, splitting, self-mutilation, and recurrent suicidal behavior, gestures, and threats are common with border personality disorders. Personality is present in early adulthood. It occurs across a variety of situations and contexts. Dissociative symptoms include significant memory loss of specific times, people, and events. Out-of-body experiences, such as feelings as though you are watching a movie of yourself. Mental health problems such as depression, anxiety, and thoughts of suicide. They have a sense of detachment from their emotions, or they feel emotionally numb, and a lack of sense of self-identity. Idealization and devaluation of others. They alternate between high positive regard and great disappointment. This is called the splitting defense mechanism. Here's Angelina Jolie. She went voluntarily into a neuropsychiatric institute in the late 1990s as she claimed suicidal and homicidal ideations. It was reported that she had no intention of carrying out either plan. She was given a diagnosis of presumptive borderline personality disorder. She is a famous American actress, screenwriter, film director, and author. She has been given an Academy Award, 3 Golden Globe Awards, and 2 Screen Actor Guild Awards. In the years 2009, 2011, and 2013, she was named Hollywood's highest paid actress by the Forbes magazine. For your antisocial personality disorder, there's a pervasive pattern of disregard for and a violation of rights of others. They have a lack of empathy and remorse. They're impulsive and aggressive. They have a reckless disregard for safety for themselves or others. They have a deceitfulness and a consistent irresponsibility. This usually begins in childhood or early adolescence and continues in adulthood. They have a failure to conform to social norms, and they typically have legal problems or some type of criminal behavior. Here we have Jeffrey Dahmer, a.k.a. the Milwaukee Cannibal. He terrorized Milwaukee, Wisconsin in the 80s and 90s as one of the most infamous killers in American history. They were brutal and perverse sexual murders. He is credited with killing more than 15 young boys and showed no remorse for his crimes. As a child, Dahmer felt neglected by his family, and he didn't fit in well with his peers. He was also fascinated by dead animals, setting fire to things, and pathologically lying, chronic daydreaming, and violent fantasies. Therapeutic interventions include your cognitive behavioral therapy, dialectic behavioral therapy, psychodynamic psychotherapy, psychoeducation, and medications for selected symptoms. Your psychotherapy is your primary treatment. Patients learn healthy ways to manage their illness. Your cognitive behavioral therapy helps patients identify unhealthy negative beliefs and behavior and replaces them with healthy positive ones. Your dialectic behavioral therapy is a type of cognitive behavioral therapy that teaches behavioral skills to tolerate stress, regulate emotions, and improve relationships with others. Your psychodynamic psychotherapy focuses on unconscious thoughts and developing new insights and motivations and resolving conflicts. Your psychoeducation teaches about the illness treatments, coping strategies, and problem-solving skills. And your medications, not specific to the disease, more for treatment of the symptoms. Your antidepressants are for depression, anger, irritability, their impulsiveness, aggression. And your anti-anxieties are for your anxiety, agitation, or insomnia. The antipsychotics are for your paranoia, your aggression, your anger, and your impulsiveness. Nursing interventions, you want to monitor the patient's behavior closely, redirect violent behavior by means of physical outlets for the client's anxiety, for example, exercise machines or walking. Remove all dangerous objects from client's environment, sharp items, belts, ties, straps, breakable items, smoking material. You want to observe for suicidal or homicidal ideations. Mood and affect should be observed. You're looking for depression, anger, assess for paranoia, manipulative behaviors, and impulsiveness. You want to know if there's been a history of violence, you want to know their medical history, psychiatric history, developmental history, and their sociocultural background. Your eating disorders consist of anorexia nervosa and bulimia nervosa. Anorexia is a lack of appetite. This could be because of food odor, drugs, emotional stress, fear, psychological problems, infections, electrolyte imbalance, or dysthymia. Prolonged anorexia with an inadequate nutritional intake can lead to serious electrolyte imbalances, and that can lead to cardiac arrhythmias. Although eating is the preferred way, tube feedings and IV may be necessary for treatment. You want to make sure that you have accurate I&O, monitor vital signs and electrolytes, and also have an EKG on these patients. Anorexia nervosa affects females ages 12 to 18. The treatment goal is to restore nutritional health, and the symptoms include severe weight loss, low self-esteem, compulsive dieting, and disturbed body image, as you can see in the picture here. They're usually upper to middle class of Western culture. Males are less than 10%. Young women with low self-esteem seem to be a higher risk. They have a phobia about weight gain. They feel like they don't have control over their weight. They're very mistrusting. Symptoms can include dry skin, downing hair covering body, bradycardia, constipation, cardiac dysrhythmias, electrolyte imbalances, hypothermia, hypotension, muscle wasting, and puffy face. And they may have bizarre food rituals and deny having any type of problem. Your nursing care, you want to have a therapeutic relationship. You want to monitor vital signs, keep daily weights, monitor intake and output of foods and fluids. This needs to be a multidisciplinary approach. They need treatment early on. You want to restore their nutrition. That is the main goal, is to restore their nutrition and prevent life-threatening electrolyte imbalances and arrhythmias. This can be fatal for 18% of people with anorexia nervosa. You want to have a positive reward system, praise any small achievements in weight gain, not intake of food, but the fact that they've gained weight. Privileges may be based on weight gain. This damages self-image or self-esteem, and this is an underlying cause of anorexia nervosa and may need to be addressed with psychotherapy and behavioral modifications. You may want to include their significant others or their family. They have altered body images, and their self-esteem issues must be addressed for an underlying cause. We already discussed some of the complications. They have poor nutrition. They have electrolyte imbalances. Their vital signs can be decreased. They can have a fall in blood pressure or pulse. They are prone to osteoporosis and muscle loss. They are candidates for diabetes. And here you'll see a video. It's only about 4 minutes on a survivor of anorexia and how her story began. Make sure you take a few minutes to watch that. Now we have our bulimia nervosa. They eat massive amounts of food at one sitting and then purge the food by intentionally inducing vomiting so weight is not gained. They excessively exercise. Many of the same symptoms as anorexia nervosa, with few exceptions. They spend a lot of time in the bathroom, especially after meals. They have enamel erosion of their front teeth and staining from the acid of vomiting. Fluid and electrolyte imbalances, dehydration, metabolic alkalosis as gastric acid in the stomach is lost, hypokalemia and hypocalcemia, and they use laxatives to make sure that they have regular bowel movements. This helps them to maintain weight loss. Your treatment goal is the same with anorexia nervosa. You want to restore that nutritional health. Nursing care, they need to have a therapeutic relationship. They need to have their vital signs and daily weights done on a regular basis, as well as their intake and output of foods and fluids. the same as anorexia nervosa. There's a video here, probably about 5 minutes long, to just give you a little overview of bulimia. Your nursing diagnoses include eating disorders. You have your imbalanced nutrition, less than body requirements, and your body image disturbance. If you have your care plan books, I'm not sure if you do, but if you do have the care plan book, you can look at page 720 through 721 and look at your eating disorders in your ATI book in chapter 18. Here we have one of our review questions. DBT is a specific treatment for which of the following disorders? And your correct answer is 4, borderline personality disorder. Then your last review question is, which of the following are symptoms of DT? Select all that apply. And your correct answers are 1, 2, and 3.